All right. So I am the moderator for this evening. My name is Frances May, and very excited for us to really dig into it and talk all about surgery residency interviews. Lauren, do you want to go next?
Yeah, excited to have you guys all here tonight. I'm Lauren Umstead. I'm a facial plastic surgeon. So I did ENT residency and then a facial plastics and reconstructive fellowship. I'm an open book, so you can ask me whatever. I got my 4-year-old here, just probably hanging out for a few minutes until he gets bored.
Liz, do you want to go ahead?
Sure. Yeah, I'm Liz Malfris. I'm a chief resident in plastic surgery at Penn. This is my cat Lewis. We just moved into this new house, so I don't have like my whole setup yet. I've missed my ring light, but this is what my face looks like. And yeah, also like happy to answer any questions. Definitely speaking today from my personal perspective, not representing my institution, but like certainly happy to chat strategy.
Amazing. Mel?
Hello, I am in a hotel room in Pittsfield, Massachusetts, which is not my usual place, but here I am, and I'm also an open book, so happy to answer any questions.
Amazing. And so great to see you, Mahitha. Do you mind giving us an intro?
Yeah, can you hear me?
Mhm.
Okay. I am Mahitha. I'm a fourth-year urology resident in Seattle. I am also an open book. I love talking about difficult topics in residency, but also I love giving tips and stuff, kind of part of my content on social media. So really happy to be here.
Amazing. Thank you so much. I love it. We do have a lot of open books here. And honestly, like this is what we want. It's very beneficial because when I interviewed, a decade ago or so now, how to nail the residency interview was really part of the hidden curriculum of medical school and of getting into residency. And it just does not need to be that way. I love that it is moving away from that. And so please, no holds barred on questions. We do have a couple topics that we want to start off on and hit. We'll get everyone to weigh in, at least like 2 to 3 people per question, and then we'll come back around to questions, okay? So let's get into it. Let's start first with mindset. So I think that it would be really interesting to hear your perspectives on what did you think that programs were looking for when you were preparing versus what do you now know that they were actually looking for? Because you guys have also been on both sides now of the interview table, right? Like we all have. And so, yeah, I'd love to hear that compare and contrast. Whoever wants to go. Yes. Thanks,
I'm
Mahitha.
happy to, since I'm like fresh out of the applying to residency and kind of on this side and that side. When I was applying to residency, I think it's in the same way for med school. It's like a checkbox. You have to check certain boxes. You have to check a research box. You have to check a clinical, interest box. For some specialties like urology, they really value what other people from other institutions outside of your home institution has to say about you. So making those connections, doing research or doing these kind of away electives at other institutions is really important. And so, and then at the time I was applying, I know some people are like, you're old, but step one was not pass fail. So step one had a score attached to it. And so that was also very important. So I went into residency being like, okay, these are the check boxes I need to be excellent or good at for them to offer me an interview. But then once they offer you an interview, those things like don't really, they kind of go to the wayside because you're like, okay, you have been selected out of like the top candidates out of like the whole pool of applicants that have applied for them for that program. So an important mindset to have is that like you are interviewing them as much as they are interviewing you, right? Like you are the prize, right? They saw something in you. They saw something in your application. They saw something about you that they want to get to know more about. And so you are already there. I'm so sorry I'm on call, but you are already there for a reason. So just that's kind of the mindset that I went into residency interviews with. And they do want to see somebody that has interests outside of medicine, that is a human being, that is an interesting, like has interesting aspects about them, but is also very like hardworking and is willing to work hard and to become a good doctor, surgeon, whatever they may be. Now that I've been on the other side, I do really think that some of the things that we really, really want to see is somebody who wants to be a team player. I think that's something that like it comes up so many times. It's like, hey, we feel like this person knows how to operate on a team, is, helpful, is willing to really like help out when and kind of fit into the role that is needed on a team. And so I think emphasizing that aspect that you're hardworking, you're driven, but you're also a very, very good team player. I think that is something that we do look for.
I love that. That's so true, Mahitha. And with the team player, I do think that prepping ahead of time to go that extra step of be specific. What can you point to in your life that is indicative of that? And so people will commonly speak to sports experience, like any athletic, any team, but certainly, I mean, Model UN, robotics team, just literally being able to point to these are the years that I spent like functioning and playing very nicely on a team. What about you guys?
I think it's a great question. I think what I was most nervous about when I was going into residency interviews is like I was insecure about not knowing enough. Like I think I was worried about whether I was gonna like know the answers. Like almost like I thought they were gonna like ask pimp questions in the interviews, which like occasionally happen. But I was like very concerned with my plastic surgery knowledge. And then looking back, what I realized is like they're really much more focused on personality and like whether or not you're someone that they want to see and spend time with at 2 a.m. when you're in a take back. And that's like in a way like easier. And that I think it just requires you being yourself and being like a normal, friendly, like interesting person. But I think I like stressed a lot about the kind of more technical aspects when in reality, I think I think at least in plastics, I feel like a lot of it is a personality test of whether they feel like you're someone that they want to spend time with. So I sort of wish I just relaxed more and just like not worried about it. Because I think if anything, there's a penalty sometimes for people who are overly polished, overly prepared. Like if you say exactly the right thing with exactly the right words every time, that's going to be boring and they're not going to remember you. And so I think approaching it with a little bit of like, just embracing that you're an individual and that you're going to show that on interview day is a good strategy.
I love that. That actually dovetails into a question we already have in the Q&A box. We'll pepper these in. So
Great.
What are some cliche answers to avoid during interviews?
Well, that's a great question. I feel like just in general, like it's so the hardest one to avoid because it's true is that we all want to help people. Like we're all in this because we want to help people. But I do worry that the minute you say that, everybody's like, oh, okay, you're going to say the generic thing. I don't know how you avoid it in certain contexts, but that's the one that springs to mind for me. And like also if you're gonna talk about a weakness, like try to make something, don't just say that you're like you work too hard or like you're too nice or like you care too much. Like just try to actually come up with something that seems plausible.
I love that one. I think I will echo that. Put me down also for don't make your biggest weakness an obvious strength, because that's like a trick that maybe worked about 15 or 20 years ago, but now people do see through it. I think it's overused. Hey, Brooke, great to see you. Do you want to do a quick intro?
Yeah, sure. Sorry guys, we added on an inpatient Whipple, as you can imagine. It's
Inpatient Whipple.
Wow.
so anyway,
I'm also on call,
Yeah.
Brooke, so I'm just like doing some
Yeah.
management here.
yeah.
Not
This
a
is going to be you guys.
Yeah.
This will be you soon.
Yeah, you chose so well. No, love it. But I'm Brooke. I'm in my 7th year of general surgery residency at Northwestern in Chicago. I'm going into trauma fellowship in Philly next year, and I'm excited.
We're gonna hang out.
Well, yeah. Oh my gosh, I know. When I saw you on this, I was like, that's awesome. So are you staying in Philly?
Yeah, I'm staying in Philly.
Amazing. We will
We'll
totally
be-
hang
we'll be-
out. I was like, oh no, she's graduating. Okay, anyway, we digress. But yeah, so I'm excited happy to answer questions along the Gen Surge front. I think I'm the representation there here tonight, and to obviously listen to what everyone's questions are. And you have some wonderful advisors in this group also.
Absolutely. Well, yes. Thank you again all for being here. Does anyone else want to add to like the cliche answers that are just overused? We should avoid them.
I was going to add a tiny bit to the like sports stuff. So for ENT, when I was going through, it was super competitive. I went on 21 interviews times like however many people you interview with, at least 6 per program. And I was a competitive gymnast in college, and every freaking person asked me about gymnastics. So as much as I wanted to like relax and be myself, I also got really fucking annoyed with being asked the same question over and over again. I do think in retrospect I came across as like bored and just wasn't super passionate in my answer about gymnastics. You kind of have to like hype yourself up to talk about the same thing over and over again because if you're like the world barbecue champion or own snails at home, like if it's something interesting, that's good to talk about, but also you're going to be asked about it like a million times. So I think in retrospect, that's something I would have done different is try to like pretend to be a little bit more passionate about my gymnastics career because it eventually just got boring to talk about.
Speaking of boredom, I also think we underappreciate how bored the interviewers are. Like, they are bored, especially if you're at the end of the day. Like, you're almost better off just like, if you have an urge to say something a little off the wall, like, I don't know, maybe it's bad advice, but I wouldn't suppress it because I feel like they're developing a shell against all of the answers they've heard all day. And you need to say something, it's better to be real.
And also, like, just to piggyback on that, it's like you want to go to a place where like the people are going to welcome you for who you are. You know what I mean? And like, I know that's
Exactly.
really, really hard. Uh, you know, I know that's really hard to be like, well, if like I really do want to impress, and I want every institution to want me, but I will tell you right now, like if I could do my rank list all over again, I would put the institution that I'm currently at like really, really high. And that's because like it's clear that I matched here because they really, really liked me and they liked every part of me and they liked all of the unhinged answers that like I gave. And I'm not so sure that I would have been happy had I matched to another institution that may not have ranked me because they didn't like those answers. You know what I mean? So I do think that everything works out in the end and just like trust yourself and that's why we say be yourself in these interviews.
Yeah,
That's very
authenticity
true.
is big. It's everything. And
I heard
I will say that like as somebody who was not a sports person, I did not have any team, anything. And I was maybe like the most roasted for how authentic I was. Like when I graduated residency, they put a little like PowerPoint together about how I ranked that program, Baylor College of Medicine, second, and I sent them a thank you letter and I was like, "Thank you so much for interviewing me. I have ranked you second." That's where
Don't
I
do
match.
that. That's a bad idea.
I can't with you.
a straight
sorry,
shooter.
like-
We like that. I mean, I do think that most surgeons I know respect really direct, honest communication. So Mel really, wow, paving the way.
So I don't know, maybe things have changed, but I was like radically authentic. So who knows?
Yeah, the last thing I'll say about that really quickly, I did hear an attending recently in ENT. He was giving a talk, and one of the things that he mentioned was like on the department side, there is such a thing as buyer's remorse. Like if you act totally, totally fake, like again, I wouldn't go to extremes. If you act really, really fake on interviews and they match you and a different person shows up in June for the July 1 start, there are stories of like buyer's remorse out there. And so, better to be yourself to everybody's point. Since we actually just touched on it though, Mel, I think really brought this to everyone's forefront of mind. What is the policy, personal policies, practices on thank you notes after interviews? Do you guys do them? I mean, I definitely did not tell people what they ranked. I was not so bold.
In plastics, there's like specifically a rule against it, and you should just listen to that because honestly, the thank you notes are mostly just an annoyance to the program. So that's the way plastics is choking it.
In urology, communication initiated by the programs is illegal, but communication initiated by the residents and applicants is not. So I did send a love letter to my top 5. And I was very generic. I never said I didn't have the guts to be talk to Thacker and be like, you're my number 5 and you're my number 4. But I will say that after I sent those love letters, the only institution that responded to me saying we'd be happy for you to match here, anywhere you're going to do great, was the institution that I'm at right now. So I'll just say that.
Yeah, it's for Gen Cert. So I've interviewed a lot of times. I personally can say, and the people I know, whether you thank me for taking the time out of the day does not change anything for me. And I would rather you take all that time, if you cumulatively add it up for how many interviews you're doing, and just like go detox and spend time with your family. Um, but I don't want to speak on behalf of everybody, because I could imagine there might be more traditional people who would appreciate a thank you. So I think maybe ask the program coordinator of the interviews like on the night before, or like there's a interview like session a lot of times the night before for residents, and just be like, hey, what's the vibe of your program? Do you guys like thank you things? And like I would very honestly tell you the night before, like, do not send them for our program. But again, I don't want to speak that and like have that be negatively affecting. For fellowships, I did not email a single interviewer thank you for interviewing me. Like, I personally think this is a part of our jobs and we should be excited to like interview you all. So I don't want to be thanked for that. But I agree with Mahitha with like the love letter thing for fellowship. I just did it to my top 4 programs, and the most warm response I got was to the program I matched at too. So I wouldn't take that with a grain, like I would take that with a grain of salt. When I matched residency, I got a really nice one for my number 1, and Northwestern was my number 2. So like, you never know. But I think the most thing everyone will tell you too is never lie. So never send multiple places that you're their number 1. Like that stuff, it's too small of a world, and you don't want to be a liar. This is some statement too. Like, just don't lie. So you can be vague and be like, you're a top program to your 2nd through 5th. The 5th doesn't need to know they're different than their 2nd, but the first one is just save the first email for your number 1.
Yeah, I totally agree. I personally, in ENT, I sent love letters to 3 or 4, and I only told number 1 that they were my number 1, and then just didn't tell the others. You know, I think I used vague language. You're one of my top choices. Okay, I think that this is really interesting, which is the question, okay, what are everyone's thoughts on sending a letter of interest for an interview later in the cycle, say late November into December already, if you haven't received an interview invitation for a program you're very interested in?
So I did do this just for a couple programs. So for me, like I did it in a situation that was very specific, because it was basically a program that was in a place that I had a personal connection with, and that personal connection was not visible in my application. So it basically, I'm from South Carolina. There's a program in South Carolina, just one. They did not offer me an interview. And so I emailed them and was like, hey, my family is from there. Like, this is like a place that I have a real connection with. Like, I would love to interview there. And then it actually worked. Like, they did send me an interview invite. But I think I would not recommend like any kind of generic blanket anything is not going to work. But I think if there's a specific reason or a specific tie you have with the program, especially if it's not in your application, that's a reasonable thing to do.
Retweet.
So it's different now with the signals. So I don't know how much these letters of interest actually work, because like I think ortho, you signal like 35 programs or something. I'm speaking a little. So like if you're going to send an email to a place and you didn't signal them, they already know you're their 36th or less choice, right? So it's kind of hard to like make an argument at that point. I don't think it hurts you. Like if you already didn't get an interview saying, I really want an interview, they're never going to remember that. So you can go for it. But I think the signals are a little different than what we had.
Totally. And I guess this could also, like, if you signaled a place and then they didn't offer you an interview, I do think that then I think this can help in that situation. Like Dr. Malfris said, like, I said personal connection is your wife or partner or husband, like somebody there that is like couples, like, are they trying to match with you? Family, personal connection, something that like, is there even like any kind of update on your application? Like, hey, I just wanted to, let you know that like my step 2 score, like just something has to be different that they like wouldn't already know about your application.
I would say if someone said, when should we send it? I would say if you already know that the invites have gone out. So like either follow one of those like threads on Reddit or SDN or wherever they're posting these days. Or if the universal day has passed, I would not send it before, because then that's a little obnoxious because you don't know. So like once you have confirmation a round has gone out, then I would send the follow up and just again, like they were saying, if you have something specific to say, definitely include that. I will say I did get, like, I had more generic. I looked up what I liked on their websites. I did it to 6 programs. This was pre-signals, and I got 3 out of the 6. But personally, for me, like, my step score wasn't stellar. So I think maybe I missed the threshold for some things. So I think, like, if you put that in, like, maybe it was a test or grades or something, or you know what, something just on your application maybe didn't meet the threshold, then maybe that helps more. So I don't know.
You guys, I think, hit it on the head. Like, especially Mahita saying something has to be different. I definitely do not recommend sending a letter like that and then giving nothing and just saying, I really love you, I'm a super fan. That is not compelling. So whether it's the updated step score, my family now moved there, that's new info, something to that effect. I want to make sure I did see a couple dings for this question. I'm just going to go ahead and read. So I'm a Gen Surge applicant for IMGs who are sitting only a handful of few interviews now and feel the pressure to do really well with the few interviews that we have. Any advice there? And then when should we assume the interviews will stop coming? Universal Day was just last week. And that's a Gen Surge question.
Yeah, I'm guessing there's probably the most IMGs applying to Gen Surge. I feel really bad on this topic because I really do think it's program dependent, and I'm probably not the best person to ask, and I'm really far away from all of that. So I really apologize if there was supposed to, I just don't want to speak out of turn to this. I don't know, but I mean, for the what you should do to stand out, I honestly don't think that should be any different than advice I would give to everybody, which would be like highlight. I think they talked about it in the beginning before I came on, like highlighting your strengths, highlights what makes you unique. And then I think, like, giving a touch to why the program when you're interviewing at that program and making it personalized to why you think you'd succeed at that program is true regardless for what school or what state or what country you're coming from. As for like what programs offer what, I definitely don't want to deep dive into this, but in the current state of the world, I think that's a really complicated topic that I unfortunately do not have all the information to.
Um, Last year, so I can speak for urology. Last year, my program interviewed, I think, 3 IMGs. Um, we matched one of them, and the other 2 matched elsewhere. These folks had a lot of research experience. I think that's something that urology really does value. So they actually had taken 2 years off to do research. And whenever I get a lot of DMs from IMGs, particularly from India, who are like, I don't know what they're looking for. And not just for urology, for medicine, for neurology, for all that. And so I have, taken time to look through their applications. And I agree. I second what Brooke said. It's not like you should approach it any differently other than just put your best foot forward and be authentically yourself. One thing I will say, though, is that in the United States, they do care a lot more than just your scores and your grades, right? That can only get you so far. But really bringing your personality, why you would add value to, and add a diverse perspective to the field of medicine. I think thinking about these things and trying to bring that out in either your ERS application or your personal statement, I think is something that I have told IMGs repeatedly, because my mom did medical school and everything in India, and for her it's all about the scores. It's just you get the top score and then you get placed, right? But it's very different here. It's a very holistic approach, and I think that's like a very different way of approaching applications. So that is, don't be afraid to take research years. I mean, if you want to get to where you want to get to, don't be afraid to take more time and really, really put your best foot forward.
Yeah, I think it has to, it's not just meritocracy here. It is meritocracy a lot of other places, and understanding that's a cultural shift, and then also getting out of your own brain and thinking of what you have to offer or what you want, getting out of get energy and really sitting in the shoes of the institution that you're trying to apply to or the people that you're trying to appeal to, and trying to think about what they want. What do they want in me? That is so huge. And I mean, that's probably across the board a good thing to do. Get out of your own, take your hat off and sit into the hat of the interviewer, of the people who are considering you. That is the most important thing that you could possibly do.
Love that. I even and absolutely, we're going to do Jade's question next here. So we'll get to that in one moment. But I even want to break this up just because Lauren, in her practice, I mean, I'm sure you interview everybody. Like Lauren runs her own entire facial plastics practice, her own whole team, which is like growing every day. So, you give us the latest numbers. But I guess I would love to hear. I think that Lauren can give us pearls more broadly, more generally. Like literally, when somebody is sitting across from you, what are you looking for from that person? And it would be helpful to hear like the energy that you want, or like what things are you trying to make judgments based on.
And I think, as a senior resident, hold on just a second, buddy. Oh, can you guys still hear me? As a senior resident, we did interview junior residents. And then now as an employer, I interview people for various jobs at my office. And I have learned that I value two things as the interviewer: intelligence, like just, okay, give me that, please. I'll give it to you back in just a second. Um, so just intelligence, and then emotional intelligence. Intelligence itself is already a check box for medical students. Like that box has already been checked. As an employer now, like when I interview people for the front desk, for the people who are going to be answering the phones, answering the text line, in charge of autoclaving my equipment, that is not yet a check box. So I have to make sure that they have like it sounds bad, but like an IQ of like a certain number so that I can like teach them stuff. And then emotional intelligence, if you've not read about that, I'm sure everybody has kind of a vague understanding, but it's just like social awareness, reading a room, being able to read your colleagues and your friends, the people that you're next to. I mean, I would say when I was sitting around with prospective residents, so medical students who are interviewing at our institution, I literally just asked myself exactly what Brooke was saying earlier. Like, could I be with this person at 2 a.m. scrubbed in? I did not care at all because I already knew my program director had like gone through their applications. But for me as a resident, I did not want to work with people strictly based on like academic achievements. It was like, how can I like work as a human with this other person? So things that were very put offish to me and still are put offish to me are like people with a huge ego. That is an immediate no. That makes it very difficult to work with them. So it's good to come across as confident in your interviews, but never like an egomaniac because you're there to learn. And then like reading the room in a sense, this goes back to kind of like what Liz was saying. Like if you're the last interview of the day and this person is literally falling asleep in front of you, it is not the time to like drone on about some boring research project that you did. It would be best to try to like crack a joke or like maybe poke fun of the fact that they like look a little sleepy in a respectful way. But like, I think reading the room is super important when you're being interviewed. So those are my little like two tokens: intelligence, which you guys baseline check. You've been through undergrad medical school, but then emotional intelligence is something that I would really like dive into and read about. And unfortunately, I think a lot of that is like innate, personality based, but you can foster some of those components of emotional intelligence. And perhaps this is where like doing mock interviews at your school, recording yourself, answering questions. This goes into like body language and things like that. It's all of like the soft things that you have to be aware of during your interview that are super important.
I really think all that stuff is more trainable. That like I think we always talk about that as like either you have it or you don't, so then it ends up not being that useful. But I really feel like it's like kind of like you mentioned, like doing like writing things down. Like I wrote down a lot of my like I sort of had a list of like generic questions, like what are your strengths, what are your weaknesses, like why do you want to go to this program, like all those questions. I wrote down answers and then I like went over them with a friend, like not anyone specific, but just like somebody to be like, if I said this to you, is there anything that you'd be like, that's weird that you said that, or like anything like that? And even though I think I'm a pretty emotionally intelligent person, there was like random stuff that they're like, oh, like it would never would have occurred to me that that could be something that could be misconstrued. And so I think doing that work goes a long way, like regardless of whether you baseline consider yourself someone with EQ.
Yeah, we
Yeah, and
always
at
go
the
ahead.
same time, like, oh no, go ahead, Mahita.
No, I was just gonna say, like, there's a very common saying in surgical fields here is that I can teach a monkey how to suture. but I cannot teach a monkey how to like be empathetic towards patients and like bedside manners and being a team player and like really reading the like all those things. Like yes, you can learn over time, but it's really nice when people already have that.
Yeah, and it is teachable. Like I mean, I've been a complete social idiot my entire life, and I'm a master coach. So if you can teach me some stuff, then you can teach people things. And there is Albert Mehrabian's 738-55 rule. He's a UCLA professor who talks about how to basically influence people and like get people to like you. But this actually applies everywhere. It applies not only when you're interviewing, but also when you're interacting with patients. And it just states that 7% of what you say is absorbed by the person you're talking to. 38% is your tone of voice, and 55% is your body language. So if you want to get 93% of your message to come across, it doesn't matter what's coming out of your mouth. It has to do what's happening in your brain, your thoughts, and the emotions in your body. And so you have to have congruency. Like animals we're social primates. We're highly sensitive to incongruency. It's just like when you have like an elk who like notices like out in Africa and like there's a lion who's the predator and he's like sniffing around on something and like pretending not to stalk this elk. Like the elk is going to be like, what's going on? Like clearly something's happening. Like there's some incongruency here. Whenever we are not congruent with our thoughts and our feelings and the words that are coming out of our mouth, that kind of sets people off. And so you want to like just double check, are my thoughts and my feelings congruent with my message? And if they're not, you want to just clean that shit up. You'll be good.
I love you guys are dropping tons of wisdom here. This is incredible. I am a big believer in the learned approach. You know, I definitely echo Mel. I am a person who definitely had extremely low levels of Riz growing up. And now I do fine. Like I got myself up to just working appropriate regular levels. And that was from doing it the old-fashioned scientist way, which is that I read a lot of books about charisma. That's it. So, I mean, again, I get it. I'm a big believer in reading about it because different books have like great tips. So yes, that's great. I think that I wanted to make sure next we hit Jade's question, because this probably applies to everyone here in the call. Can you give good examples of why surgery answers, and how long should that answer be, and what are cliches to avoid?
I can start by answering that by saying something that I wrote in my personal statement that I think I like at the time resonated with a lot of folks. Uh, I am a dancer, and I really resonated with surgery because the day in and day out of an operation, like from beginning to end, to me felt like a choreographed routine with improvisation here and there. And that is what I love about dancing, is that I get to choreograph. I memorize steps to a routine, but I add my own flair to it and I improvise. And so I say that I wrote my personal statement on that essentially. I especially really loved like the robotic aspect of surgery because there's like a lot of leg and arm movement, and it really did feel like a choreography that was being done very like effectively. And every surgeon has their own style, right? Every surgeon has their own strengths. And so I made that comparison, and essentially it's like something that was personal to me, in trying to show surgery in a light that maybe a lot of people have not thought about it before. I know like not everyone like necessarily needs to have that, because I do think that it does get a little old to be like, I love working with my hands, right? And I think that's something that a lot of people say. And I think that's okay. But if you can really bring like a personal perspective to it that maybe other people haven't thought about, I do think that that ultimately is helpful.
And I would say that one good book, Simon Sinek, Start with Why. Like, really take time. Don't just try to like come up with an answer for your interviews. Like, this is your career. Like, why? Like, sit with that question yourself and like really try to think about it. Like, why do you like surgery? Which is not sometimes like the easiest answer, but I think It's a good book to think about to get the thoughts flowing.
Yeah, because even like Mel said, I do think that like if you in your bones don't have the answer like really solid and very earnest that you can show up in this authentic way, I actually do agree. Like in micro expressions or maybe some syntax, like I actually do think that people can detect that, right? Like there is evidence in the literature that shows that, but also we know that because I feel like if somebody is sitting in front of me acting slightly squirrely, I may not know why they're being squirrely, but I will detect squirreliness, right? And the best way to combat that is to just be genuine. I really loved, I want to make sure that we hit this. We had a couple people ask. So these questions are about doing well on step 2 practice exams, like being prepared, but then ultimately final score significantly lower than expected. And so how do we address that gracefully in an interview without making excuses? I want to just first say already congratulations, because I think that you are doing better than half of us were back then, because like this is the right approach, right? How do I handle this with grace? How do I show up and not make excuses and own it? Because when we own our own BS, then that's how we're really cooking. So yeah, would love to hear your guys' answer to this.
So, as like I previously alluded to, as someone that was upset with my step 1 score, no one brought it up though. So I would be surprised if people would, because actually a lot of interviews are blinded. This is Gen Search, I guess, specific. Maybe it's more malignant than others, but if you're past that threshold, a lot of them are blinded to that point. And even if they're not, like if that's what your interviewer is choosing to focus on, to me, that would actually rub me the wrong way. Like I made it through the threshold, right? Like if you're doing a holistic application, that means I had XYZ that's shown above my maybe subpar step 1 score. But if I did worry about it coming up as well. So I had already formulated. So for me, lucky or not, we had step 2 and it was scored and step 1 was scored. So I significantly did better on step 2. So that is how I kind of reframed it. So I would give that advice. You can't do that because yours is not the same as step 1, step 2 being scored, but you probably had some clerkships that you shined on and you could emphasize what a team player you are or how well you honored this rotation or your AOA or your gold human, whatever it is. Like this is like not like the strength, not like I would say like, yeah, I was disappointed in that score. And so this is why I've tried to now emphasize my research or this, because I do believe in the holistic application. And I realize, maybe when I was studying, now I have different study techniques that I would employ for the future. So like, don't completely ignore it, but just say, I wouldn't dwell on it. And I definitely wouldn't like hyper focus, because one thing in surgery is you're going to mess up every day and you're going to have to bounce back from that and you're going to have to learn from it. And so I'd almost take it as that type of a question of like, okay, yeah, but guess what? I'm still here. And these are all the other reasons that I'm doing. And this is how I know I'm going to do better in the future. But I would hope it doesn't come up. Like, truthfully, that would be a red flag for me if someone's going to hyper focus on that, but it may. So I guess that would be my advice.
Yeah, to echo what Brooke said, I like if someone asked me that, to me that's like they're not asking you that because they actually care about the score. They're asking you that because you're already in the room. So like if that were a problem, you wouldn't be there. So like they're asking you that because they want to make you uncomfortable and see how you behave. And so like to me, it helped having that mindset going in of like this actually isn't about the score. It's just about you being like correct, like I did do poorly on, like acknowledge, and like they sort of like they want to see how you would react if you messed up with something on the floor. How are you going to react? And that should be you acknowledge it, you take responsibility, and you talk about how you're going to do better, or you pivot to talk about like the things that you're doing that you think kind of make up for that or like that are more important. So I think there's a lot of at least in plastics, a lot of mind games, a lot of like it's not really the question, it's how you react to the question. And so that's why you just have to sort of like you can't let them see you sweat. It's kind of how I feel about a lot of this.
Yeah, I've definitely seen trends there because I do think that this is specific to us. This is what we're getting into is surgery interviews. And I do think that surgery interviews invites some level of mind games in a way where when I see like my colleagues and my peers in peds, they're like, we legitimately, we played with Play-Doh the whole time. Like it was just vibes. We had such a nice combo. I heard about like their family and we're talking surgery today. So this is super helpful. I want to hit this question next. How do we redirect inappropriate, sorry, the chat keeps moving. Okay, inappropriate questions about significant others, kids? Do you want kids in residency? Anything that, I actually think that those are interview violations, right? You guys correct me if that's still the case. They were when I was interviewing. Like you couldn't say that. Talk about mind games. I've also heard of people like asking the question in the form of a riddle, and they'd be like, I'm not really asking, but they would hit you with a riddle. Have you guys seen this personally? And then my question would also be, how do you recommend handling it?
Those people suck who ask those questions, but like I got asked those questions multiple times. My approach, which may not be for everyone, is I answered all of them directly and honestly. And then I made a mental note of like, I'm going to try not to go to this program. Because to me, it's like, if you're not willing to follow the rules on like the day when your program is under the greatest possible scrutiny from outside people, like you obviously, this is not the program for me. So that was my attitude.
Anyone else?
I had a lot of regrets from the interview trail. One was not being more excited about my own application, but the second was I actually didn't wear my engagement ring to a lot of my interviews because I thought it would invite more of those questions. Now, I still got asked those questions, and I answered them truthfully that I was engaged, that I did want to have children. But I was like so uncomfortable answering them. So I'm sure I was like squirming around in my chair and like turning red. As an employer now, I know it's illegal. I can't ask those questions, but I still skeet around. I'll be like, so tell me about you personally. Like let's talk about your, I don't want to talk about your application, bro. Just tell me about you. And then often they'll be like, oh, I'm married, I have 2 kids. And then then if they open the door, then I'll be like, oh yeah, tell me more about that. So be prepared to answer those questions. Like if you bring it up, they can then maybe just roll the ball down the hill a ways. I also think this is where you can bring in that like joking emotional intelligence. If you feel comfortable and if the mood's right, you can be like, you're not supposed to ask me about that. Like I do think some surgeons want that little bit of like kind of back and forth. But I'm not necessarily advocating for you to do that. I'm just saying that's an option of a respect. You can be truthful, you can lie, you can tell them to fuck off, or you can like make a joke about it, are kind of the answers in my mind. And I kind of did a little bit of everything.
I will say, I guess for the general surgery people on the call, so I did 15 interviews for residency and 15 for fellowship, and I've never a single time been asked about my anything. I don't know if that's because my whole life's online and people can just look it up if they want to, but I've not. So I don't know, maybe it's because when they ask me, tell me about yourself, I go on a 7-minute spiel and then we have one conversation question after that. And I tend to talk and answer questions really loquaciously. So maybe that's one of the things, because you get to the end, every interview is going to have what questions and you have. And that was almost my goal in fellowship, to not get to that. So I would just like ramble for all the questions. I'm not saying that like if people want to ask you that question, they're going to sneak in that question no matter what. But it's becoming less and less common. I think there's still some of those like, hanging on at the end. But at least at my program, we have like specific interview questions. You're not supposed to go off of those topics, and we're handed those maybe because of people who were bad examples in the past. And so we're like, each of us has like a topic for the room and we have 5 questions. If you get to the end and then it's like, what else do you want to know? Or tell me more about yourself. Sometimes it lends to that. But yeah, I would, there are ways to report. I've had it on my social media page before. I'll try to put it up again this year. You can wait till you match to do it. There's no like statute of limitations. So if you're worried about that, or wait till you submit your rank list or something. But I would absolutely encourage reporting it because it's not acceptable.
That's awesome. Yeah, that's how the needle moves gradually over time, like in the right direction and more legal direction. I do think that even going back to part of Lauren's advice, the like joking, I definitely, absolutely, like I agree with humor as a diffuser. I think that one of the best arts, like if I could tell you guys charisma, and read and learn and get your skills up in the charisma realm, but then also easing other people along, like having that ability to just ease other people along, make people in the room comfortable. That is like a specific skill. And honestly, I do think that traditionally in surgery, they don't model that for us. So you just got to learn it elsewhere, and it will make your life much easier, and it will make it easier for other people to like you and want to be around you. But anyway, going back to the joking type of response, this question about the line between ambitious and confident versus being cocky. So would love to hear from everyone. What is an example of genuine confidence that comes off to you in an interview versus now you're thinking that they're arrogant?
It's really hard. I worry it's one of those, like, when you see it things, which is not super helpful. But the main examples I've heard where someone like ended up coming across as too cocky are like situation, like you just always have to consider your audience. Like you are sitting in a room with like, just assume the most esteemed surgeons and whatever you're talking about, like they are the experts. And when you're in that room. And so I think the situations I've heard where people are like get portrayed that way, it's like they come across as almost like mansplaining to the faculty about some case when like the faculty obviously know way better than them. So I think it's mostly just about maybe even explicitly acknowledging that you don't know as much as they do, and that like because of your position, like you just obviously are not as expert as they are. So I think just keeping that in mind, like just keep in mind who you're talking to. You're not talking to your friends, you're talking to these like esteemed experts who you know, ultimately know better than you based on their experience. But it's a tough one. I agree.
Yeah. I think there have been a few situations where I've been on the interviewer side and I'm like, like that the way they told that story just didn't like sit well with me. Right. And I'm like thinking about that. I'm like, what about it was like not sitting well with me? And I think that you can always talk about your accomplishments while being grateful for what you have, for being grateful for your teammates and for other people who have helped you come along on that pathway. Being acknowledging that and being like, just even saying that, right? Like if instead of like if I said like, oh, I like, put together this like research project, I got all the data and like I did all of this, right? I could say that, but I could also say like, I was really fortunate that I was able to have all this data that was available to me, and I had the wonderful opportunity to be able to put it all together and then analyze it. And it was really interesting and really cool, right? Like when you're saying like, oh, I'm like excited about this, really interesting and really cool to see the results that I got, right? You're able to say that in a way that doesn't say like I did everything, but just kind of at every step of the way be like grateful and happy and just like excited that you got to be able to do all these things. Other thing I would say is never dunk on other specialties, other people, other like other services. I had an interviewee once who, when I was like, essentially the question was like, how do you resolve conflict, their answer was like, this nurse practitioner was dumb and wrong, and like immediate do not rank, right? Like, and I just like, like it doesn't matter where you are, right? Being open to other people, like giving feedback and their ideas, like that is something that we look for. And oftentimes cocky people will say in many different ways and shapes and forms that they are not open to receiving that kind of feedback. So, that's just like, it's not what you say, it's about how you say it. And just always mindset of uplifting each other, never the mindset of dunking.
I have a really good example of that with like my son who had an A+ on his test recently. And I had to like go to the whiteboard with this because he was like, I was celebrating him. I was like, yay, like you got an A on your test. Like, this is amazing. And he's like, no, that's bragging. And I was like, no, 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 no. There's difference between bragging and celebrating. I was like, same result, different thoughts behind it. Bragging thinks, oh, I have an A, I'm better than everyone. And now like that's like braggadocious and egotistical, and that's how you come off. And you have the same circumstances, like you have the A on the test, but celebrating is like, oh, I got an A+ on my test and I'm so proud of me and I'm so proud of everyone who has A's on their tests as well. Like it's a very different energy. So you can have the very same circumstances. So you can have like the same research as someone or the same step scores as someone, but it'll come off very differently based on how you're thinking about it. If you're thinking like, oh, it's pass fail now, but like 280 or whatever step scores were. If you're like, I got a really high step score and like, I'm so proud of me and I think I'm the best and everybody else is stupid and I'm amazing, that's going to come out in every single sentence that you speak. But if you're just thinking like, I'm so amazing, I'm so proud of me, I'm going to celebrate me and I celebrate everyone who does well too, that's going to come out in a very different way. So it doesn't matter what you say. Again, it's like how you say it, and it has to do with how you think about yourself in the world.
If you, to use language from the book, The Courage to be Disliked, that is one. I know there was a question about book recs. The Courage to be Disliked is pretty good. I definitely would recommend it to any resident, not necessarily because it will change your life on the interview trail, but I do think it would change the life of the resident during training. But basically, they just talk about if you buy into vertical hierarchies. Vertical hierarchies, medicine's pretty famous for it. Surgery, more famous than even medicine. If you buy into vertical hierarchies, that means that you do think that there's always a better or a worse. So your friend gets a promotion, they're better, you're going to be jealous. You get the promotion, now you're better than your friend, etc. And to Mahitha's point, what she was describing was at one point, it's called specialty disrespect. And that's the phenomenon where you act like, oh, just make emergency, why did the ED miss this? Radiology miss this again? They're so stupid. Sometimes surgery teams like have that type of rhetoric, that NP, just dunking on people. Specialty disrespect is for hopefully increasingly at places like a do not rank type of thing. So we don't want to like bring specialty disrespect type of vibes there. But again, truly, I would encourage anyone to, if you really buy into the vertical hierarchy, to think about why you do, but also really reconsider like bringing that energy into the interview. Because again, even with Mel's distinction and point, it's like, do you believe in vertical hierarchies or not? Because even if your step score is higher than somebody else's step score, does that make you better? Some people believe that. I've met students who think that. Okay, anyone else on the difference between arrogant and confident before we move on? Alrighty. So for the tell me about yourself question, can it just be a casual answer about who I am as a person and what I love in life without diving into the application in surgery?
I would say, based on my experience, not everyone has read your application. So I would advocate I would keep it like 90 seconds or less, but I would say I would like mention what med school you're coming from, like if you did a research year, where that is, like just like major highlights, but just like I don't think that it's safe to assume that they've actually read and know the content of your application. So I think it's okay to repeat that for that first question. If they're asking that question, keep it short.
What are examples of questions that you can do when they ask you at the end, do you have any questions? I know Brooke, her approach is, we're not going to do that today. I will regale you, and we're not doing that part. But yeah, what questions do you guys like?
I think it's super important to always have like 3 or 4 questions in your back pocket. This is super important, actually, because again, you're going to be kind of tired and bored. At least that's what I remember from this whole process. Also, I went on 14 fellowship interviews. And then the 21 residency, but like always have just some general questions in the back of your mind. Cause when on the other side, when you are a senior resident interviewing and people are like, nope, I don't have any questions, that's a red flag. So some of my like questions that I would be like, well, what's your favorite thing about your program? Or like, what do you think some of the strengths are? What are some things that are like super cool about your program, but may not have been highlighted during the presentation this morning by the program coordinator? Just those are like really easy general questions to always have in the back of your mind. And then emotionally intelligent people piggyback on, sometimes if they give you an answer, you can double down and ask another question about what they just offered you. Because that signals to them that you don't just have a checklist in your head, that you're like listening to their answer and engaging with them.
Yeah. Like I said that a little tongue in cheek. Like you definitely should have questions to go. I think some of the things that are like would stand out to me in the applicants is if they mentioned specific things about my program, because then to me that showed like they really have interest in the program. So if they like went to the website and they saw that we specifically like, for an example, like we do an apprenticeship model for some of our months. So if they're like asking me about that, or a specific research program that we offer for like our 2 years of research that we have, I thought that was really helpful. I think if you're like really stuck and you're kind of like vibing, you can also be like, ask them like, how did like when you went through this, what were things you thought of? Like questions you're asking us right now, I don't think those are off top. Like if we're having a good chat and it feels like you'd be someone I want to hang out at 2 a.m., like please ask me for advice of like what I decided when, maybe don't ask the 70-year-old who's about to retire, because it might have been different 50 years ago. But like if you're talking to someone who went through this process relatively recently, just be like, what are things you would have done differently? Or what are you really glad that you asked on that? Like you could ask those types of things too. And then it's kind of like a win-win. You're getting some secret intel as well. So
Yeah, to echo a little bit of what both Lauren and Brooke said, I think keep it positive. the time that I've seen this backfire for people is when people have asked like kind of weird negative questions about like, oh, I heard this faculty is leaving. What's the plan? Or like, I heard this thing has happened. Like, do not do that. It's just going to leave a bad taste. So I think keep like all of the questions that Lauren mentioned are like excited, the future, like, good things. And then to Brooke's point, you can't forget, this is like an EQ thing. Everyone loves to talk about themselves. Like everyone does. And so I used to, if I was really nervous, I would for certain people that I knew were going to be like difficult, I would be like, maybe this is insane. I would look in our journal and be like, what have they written about recently? And like, there was at least one time that I like said, they're like, do you have any questions? And I was like, oh, I read your paper about this. Tell me about this thing. And then they talked for the rest of the time. And I was like, perfect. Like that was, again, I believe in preparation. And I think that can go a long way, but yeah, stay positive. And then like when in doubt, let them talk about themselves. Even if it's like, what's your favorite restaurant in this city? Something like that. Like all of that
Back
is
to
good.
like people will remember how you made them feel. They'll be like, that person made me feel great. I got to talk about
You get my
paper.
paper.
Yeah.
I just want to like add a couple things to that because I had put it in the chat up there. Is like I feel like you can always ask your attending interviewee like what got them into the specialty. Like that's
That's
such
great.
an easy question. You both are into the same specialty. What got you into the same? I'm interested in knowing like what about this specialty made your mind tick, right? Like that's like such an easy question. It gets them to talk about themselves. You're also talking about surgery, right? And I know like there's this like question of like, oh, like you risk losing too much information about yourself. In the end, like Brooke said, it's like at 2 a.m. in the morning, I want to know that I can have a conversation with you and that you're like a cool person to hang out with, right? Like in the end, like no amount of research, like project number 10 that you're like an 8th author on, like that doesn't matter at 2 a.m. when you're like doing consult together and you need to be in this shit together. You know what I mean? Second thing is like you can always disguise questions if you're worried about like, oh, like they've probably answered this like strength and weakness question about the program like 50,000 times. You can always like disguise that question as something else. I learned this actually from another co-resident. He used to ask like, if somebody gave you $10 million to invest in this program, what would you do for this program? Right? Like, I think that's a great way of being like, what does this program not have that you maybe want to give this program? Right? Like, I think just thinking about just like very interesting ways to like rephrase the same kind of question, but it still gets them thinking, right? Like, are they going to do it on one thing? Are they going to do it on two things? Like, are they going to use it for residents? That also tells you like more about who they are. So I wanted to just put that out there.
On top of that, like I echo all of that. Like I agree with everything you all are saying. And like curiosity is the antidote to anxiety. So if you can really ground yourself in curiosity, especially if you're feeling anxiety, that'll really help you. But let me just share one really funny story really quickly. I got very curious when I was on the interview trail, and I was interviewing at somewhere, I think it was Penn, and it was Dr. Weinstein. And I was like, oh, is that your wife? I saw a picture of like his wife and his kids. And I was like, oh, where did you guys meet? And he's like, and he did not want to tell me the answer. Like he clearly was like guarded, but I pressed him out of curiosity. And he's like, well, I was a resident and I was a faculty here and she was a medical student. And they got married and like they had kids. If you look up, I think his name's David Weinstein. He's like a famous head and necker, but like, yeah, he met a medical student as a faculty and he married her. I pressed him for the story and he was like clearly uncomfortable. So don't get too curious. What are you telling
I
me?
thought that was going to go in a very different direction
I did too.
because of the shared name Weinstein to some
No.
so
With the
nice
guy.
people in this
Yeah,
world.
no.
That would be hilarious if you were like, are you related
Related
to
to
Harvey Weinstein? Like that. I mean,
I think
that's
it's
don't say
Weinstein.
stuff like that.
Old.
Don't go.
You would be remembered, that's for sure.
What is his last name? I think it is. He's like a famous head and neck, like robotics guy. I'm pretty sure it is Weinstein. I could be wrong.
Yeah, I think you guys, it's all very wise. I think this is such helpful perspective. I love Mahita's, like that is a very unique way to get at that angle of, yeah, like your program's amazing. I'm coming at this positively, collegially. Like, what would you build up next if you could build up anything? And, I'm sure for us, like in ENT, I actually do think that multiple people talked about like, well, I'd probably redo our T-bone lab, the temporal bone lab, or just something like that. Or they would use it as a pro where they'd say, we actually just renovated it. We have like a state-of-the-art temporal bone lab. This question, did you guys take notes during your interview, or is that a no-no? Like during, live. I see some nods. I'm shocked. You're shocking me, but I'd love to hear, yeah, if you're pro notes.
I am pro notes and honesty because I am like, I want to remember everything about your program. But I actually didn't take notes on like what they said in front of them. I took notes to really make sure that I got the question that they were asking, because I think it's really easy to ramble. I have had multiple interviewees that like ramble, and they're like, sorry, like, what was the question? That is a bad look. That like, do not do that. Right. So if it's a multi-part question, because some of these interviewee places will give you like, it's like a MMI. I'm sure a lot of medical students are familiar with like the mini multiple interview, like kind of format where like they ask you these like complex questions. Right. So I always like, I wrote down words and I was like, I just want to make sure I have the question correct. You like, the question is blah, blah, blah. And then I also have those words to kind of direct me and make sure that I'm like staying on track and not like rambling. That is how I use it. And I think if I honestly, like, I was just very honest and said like, I'm just going to like, you know, make sure that I have the question down correctly. And I think that was fine.
I feel like anyone who follows me on social media probably knows I love like notebooks and things. I always have a notebook with me. I did not write anything down during the interviews, but I did have like a cheat sheet for every interview in my like nice notebook. And I would occasionally get it out in the context of like, someone was like, what questions do you have? And I was like, playing for time. I would sometimes like, I had a list of questions in my book as like a backup thing. I think only once or twice did I ever use that. But the main note-taking thing I did is I took notes after each interview, because especially if you're doing like 15, which it sounds like a lot of people are, like they're all gonna blend together. Like some of the stories, I still don't know which program it was where they asked that weird question. Like I don't remember. But if you write down immediately afterwards your impressions, so like right afterwards, I had like pros, cons, general impressions. And I did that like on the ride back or whatever to home. And then I looked back at that when I made my rank list, because you're never going to have a purer understanding of like how you actually felt about that place than you will immediately afterwards. So I would recommend doing that.
The one other thing, because I'm really like, I get so tired after this stuff and fellowship stuff too. You like have to go back to work. So one thing someone told me to do, and I still didn't do it, but I think it's a good idea, is to record a notes app. Like just do like a minute of you talking about the program, and then you can hear your own like inflection, and like you could kind of tell like how you felt about it. So if you're like, opening an Excel sheet, like that's great for super type A people. If you're like tired or you're more type B, like maybe just recording something just to get something down. Though I do think it's helpful to trying to spend 5 minutes at least just get it down.
I also, when I would like recap stuff in my mind and take notes about things right after the interview, I actually started ranking my list like as I went,
Me too.
because I'm more like a goldfish. Like I forget a lot of stuff. So you know, if your first 3 interviews, you rank them, and then you just start sliding in like your other programs, because at the end, especially in surgery, you're going to go on a lot more interviews than your friends that are like family med, pediatrics. Like statistically, it's going to be really hard to put a rank list together. So if you just do it while you're interviewing, for me, I trusted myself more like in the actual process than doing it all retrospectively.
I did that as well, just live rankings, very easy to slot in, because I just had to ask myself the question, did I like it more or less? I mean, it literally decreases the number of questions you have to ask yourself, since it's just more binary and which slot did it beat. I love Mahita's. I do think if I could go back, I really like your Excel sheet vibe, but Excel sheets do give me life. And so I feel like that would be like my treat after the interview. I'd be like, now I get to go into Excel.
So about the program to yourself.
Yeah, exactly. And it just makes me happy. I fill up those little cells. I mean, I'm super type A, obviously. So the other thing that I would do, just because I know that we're wrapping up, we'll do one more question and then any final wrap up thoughts, because we are coming up on time. But to echo something that came up during our discussion, if I could go back, the one thing I would change that I did not do at all is I would record myself answering questions. I did not do it. I think that now that I'm older, I do record myself, and it cut down on rambling. It made my internal timer a lot more robust, so I just don't ramble and lose my train of thought the way that I did back then when I had never actually. And by the way, I do think it needs to be a physical recording because I was doing all sorts of stuff with my body and with my face that I was not doing intentionally, and I never would have known that other than watching the recording back. So definitely echoing that. Let's see. Okay, how many Gen Surge interviews is a good number to feel secure?
That's so, I don't know. I feel like 15 is kind of like
Might be
a
tough.
good number for a lot of different things, but it's going to depend on the strength of your application and a bunch of different things. But that's what I was told. I feel like that's kind of the gist, but virtual, I know it's a little different and people tend to do a little more, but I think 15 is kind of a safe bet. I was just going to say, to the last thing too of like recording yourself, it kind of hits off what like Frances and Liz were saying earlier too with like, I call it your spiel. When they say like, tell me about yourself, I do agree, like probably somewhere between 90 seconds to like maybe 2.5, like in that range. I would definitely film yourself doing that and get that down. You're going to do it 100 times. Like Lauren, like be excited about what you're going to talk about. And then if you want to include your gymnastics career or not, like be excited because they might come back to those questions, but you can have it be like mine was like a flavor. I was born in this and I have 2 younger sisters, but then I would move through that quickly. And like, I'm not going to go into details about that, but it's a part of me and it's an important part. And if they want to bring that up, cool. I now invited that. But yeah, so that's kind of, I would definitely film myself doing that.
Yeah, I think it's really easy to get caught up in how many interviews. I've had so many medical students be like, I've only gotten 5. I'm so nervous. I'm so anxious. I get it. Focus on the interview that you have. Focus on what you have. Focus on what's in front of you. Focus on the interview you have because you could be number 1 at all 5 of the places that you have, only if you have 5 interviews. But then you could have like 20 interviews and like, you don't spend enough time on, preparing for all of them. And then you're not ranked at any of like, you're not ranked well at any of them. So just focus on what you have. Don't get in your head. Programs want you for a reason. They're interviewing for your reason. Okay. So like know that like you are already well liked by the program. It's just about just being yourself and shining at where you are.
Yeah, and then so I want to take one final question here out of the Q&A. I have so many hobbies. Will that be seen as a red flag? I have a lot of research and experiences to balance that out.
Not in plastics. I talked about to me, like the hobbies section was the thing that was talked about most. I forget what exactly I put, but crosswords was one of them, which is like so nerdy. But then like any crossword person was like, let's talk about crosswords. And then it was like instant. I think it's going to like, again, like I think people are more bored in this process than you realize. Like they are much, in a lot of ways, like less invested in the specifics of what's happening than you are. And so like if you have something fun to talk about, they would probably rather talk about that. But again, plastics is a little bit of a weird space.
I think you
Put something
I
down.
think you hit the nail on the head. Like, as long as you're still like, if your application is only hobbies, people might be like, well, then why do you want to be a surgeon? Like, and also, like, do you know you're working 80 hours,
Yeah.
5 years? So, like, I think as long as you're saying, like you said, I also have this and this and this, as long as you show that you've able to maintain that. But, like, if that's the only thing you're talking about in interviews, to me, I'd be like, okay, we got to say something about why we're here today. So, but it's interesting. It's what makes you you. And like a lot of the times, like Mahitha's hobby like translates into her work, I'd make little like ergonomics jokes about being a yoga instructor. Like you can be nerdy with your hobbies too. But yeah.
Again, it's not what you say, it's how you talk about it.
Absolutely. Okay, so much wisdom that was shared tonight. I want to ask if everyone is willing to just drop like their name, info, handle. That way, like you can connect with all these incredible surgeons, online. This way they'll see how to find you. Absolutely. I think we all wanted it to be really reassuring because I do think that the world doesn't do enough to pump up M4s. Like I actually think very highly of M4s, and everything that it took to get here is what's going to take you very beautifully into your next decade. So we'll do the handles there, and then would love to just invite everyone, if you have any final piece of advice, if you were talking to yourself the week before your first interview, so you're setting out to the interview trail, it might be 15, 20, but if you could just tell yourself one thing.
Yeah, I'll go first just because I'm like, I had a busy call night and I'm like falling asleep. I'm so tired. So, yeah, if I could tell myself one thing, like stop being a weirdo. Like don't be a creepy weirdo. Like just be yourself. That's all you have to do. That's my one piece of advice.
Frances, is it like advice you would give to yourself so that you could maybe like do better? Like, is that the
Yes,
idea.
yes. Or just, yeah. And you may have even given this to yourself and then killed it. But I definitely, like Lauren, I feel like I would go back and I would get myself together differently. So anything that you would recommend?
I'll go. One thing we haven't talked about is the process is stressful, but it's also really fun. Like you're kind of like done with school. You're like opening up this whole new chapter in your life. And I think the arrival fallacy is a real thing. You're like always chasing the next thing, but like you should be proud. Like you're finishing medical school, you're going to graduate, you're applying to surgery, which all of us here agree is like the best thing in the entire world. I am so glad I became a surgeon. It's the coolest job. I love most days. And like traveling across the United States is really fun. You have a reason to like hop on all these flights and stay in these hotels and like meet other people. So try to savor that a little bit because it is kind of a once in a lifetime opportunity.
I would tell myself that I deserve to be there because I think I approached a lot of this with a chip on my shoulder because I didn't have a home program. I didn't do a research year. Like I didn't do sub-Is at a lot of the places that I went, and that was atypical at the time. And it worked out anyway. And I should have worried less about that.
I would say spend time with loved ones. You know, you're going to be in a career where like it will test like the time that you have for yourself, for your career, for your loved ones. And so that is something I do wish that I did a little bit more in my fourth year.
All righty, perfect. Does anyone have anything else they want to add? But otherwise, we are right on time. We're so grateful to all of you for coming out. Thank you for being here. Best wishes to you on the interview trail.
Yes. Good luck, everybody.
Good luck.